Jennifer Shepard, your integrative manual physical therapist. I want to talk about just the concept of our patient's humanity. And the concept of our humanity has absolutely been lost in most of the medical world, in our physical therapy communities, as patients come to us as symptoms. They come to us and they are viewed as parts or something to fix. And as we continue to grow in our understanding and in the role of our work in whole person health, through our integrative work, our integrative lenses, functional medicine lenses, integrative manual therapy lenses, as we look at the whole person, we can't just look at structure. We can't just look at organs or biological processes. We need to look at the whole person. And that goes into body, mind, and soul. And we can't separate those things. And while there's areas that we specialize in, like we are not skilled and trained in the psychology world or the spiritual direction world, at the same time, when we approach a patient and we work with a patient, we have to acknowledge that. And it doesn't have to be acknowledged verbally, but just as we sit in their presence with their nervous system, that subconscious is paying attention. It's curious, is this person friend or foe? Is this person going to help me? That whole sympathetic, parasympathetic, am I safe? How we can help our patients feel safe, how we can help our patients feel understood. So many of my patients, as they come to me, again, they've sought and work with many practitioners and doctors and professionals, and so often their concerns, their curiosities, their questions are dismissed, or they are told they're crazy, or they're told they're granola, or they're told there's no relationship. Like, they're very quickly dismissed, which is disheartening for a number of reasons. There is such brilliance and wisdom in the human body, that intuition, that gut, that innate knowledge and knowing. It's so good. I tell all my patients, your body and your deeper intuitions are so much smarter and intelligent than any of us. You inside, your body knows best. It's a matter of all of us to try to figure out what your body is asking for. What does it need? Is it nutrition? Is it movement? Is it mobilization? Is it nervous system support? Is it trauma support? What is it? But as these people come to me, there is a state of disheartening. And again, it's being dismissed from many other practitioners. And just a couple examples, as my patients come in and I work with them, as they, an opportunity to share their frustrations, which is so wonderful. And again, we are so blessed to be able to spend so much time with our patients. In our private practices, in our cash pay private practices, we get to set how much time we work with our patients. And as we work with their bodies hands-on, there really develops a relationship, a trust, in which practitioner-patient, patient feels safe and is able to work through some of these things. And yes, we're very good at what we do with regard to manual therapy. We're great at restoring tissues and structure and function of the body. But also, we can't forget how that concept of just listening to someone's story and acknowledging, hey, it's rough what you've been through. I'm sorry for what you've been through these conventional medicine practices that have really been disheartening, frustrating, kind of squashing that innate wisdom, that innate brilliance. So important for these patients to get that out, because as we look at the bigger picture and the whole, those nervous systems are still wrestling with some things. And for our patients to get to the places of healing that they need to be, if those pieces aren't addressed, if they're not addressed fully and wholly, in a place where they feel seen and heard and valued and acknowledged, that deeper nervous system, that innate next step for healing is going to be a lot harder. When the patient's seen and heard, acknowledged, recognized, valued, respected, it opens the door for so much potential, for so much